You should all be prepared for it. Something is not letting me. Is my screen
Yeah,
visible?
it's visible. Yes.
Okay. Yeah, sorry for the delay then, because I was under the impression that in India it's somewhere in October or February, not in January. So those are actually preparing for, if it's for a January exam, then you should know all this by this time.
I think
Um,
one in the UK is in just because I got a few messages from people who are in UK.
okay. Yeah, yeah, there's something coming in Birmingham, and yeah, in
Okay.
January there's an exam.
Okay. Yeah,
So
go ahead.
yeah. So what I'll be dealing with, the refraction exam is the second exam in the FRCOpth journey, but it doesn't have to be the second, in the sense that you can write it even before your FRCOpth part one. There's nothing stopping you. The same qualifications that you need for the part one exam is what you need for your refraction exam. But the caveat here is before writing your part two written exams, you should have cleared both the part one and refraction. And before giving the part two oral, you should have done both refraction and written. So it can be done in any order. It can be your first exam, it can be your third exam, or it can be your second exam. But usually the requisite is you should have done enough and more retinoscopies and practice in your clinic. At least spend 60 to 70 hours refracting with your optometrist to be able to do it in that speed on exam conditions. Because you should be able, the target is to be able to rect one eye in 3 minutes. Because the rest of the time you need in the next 2 minutes, you would be doing to document it. So coming on to the details of the exam, everything is available in the website, on the FRCOpth website. Now the people who are showing more interest, because it's there all, as Anuj rightly mentioned, it's there available all over the world now. And the first exam being a proctored exam, you can do it at home. And this is the only exam that you need to travel outside for. The other one written also is a proctored one, so you can write it at home. So the refraction and the oral exam remains the only one where you actually have to travel. So you have examinations happening in India at Mumbai, New Delhi, or for those who are closer to Dubai, Kuala Lumpur, Rawalpindi. All these are just 3 or 4 hours flight from India, depending upon where your location is. And so it's doable. Now coming to the structure of the exam. So this is an OSCE kind of an exam where you have to go through 5 rooms, and each room each station you have a 10-minute slot, and between each stations you have another 5 to 10 minutes gap. So the total exam is over in an hour or 1 hour 15 minutes, but it feels like much longer than that. But it's only 10 minutes that you have inside a single room. So 10 OSCE stations in 5 rooms. The room 1, it's a simulator. It's not an actual patient. So first 2 rooms, you don't have patients. There are just simulators. I'll just show you pictures. It's there in the website. The third one is performed, third room, you'll have a patient, which is a non-cycloplegic. That means the pupils are not dilated, nor are they cycloplegic. They're performed on patients. And room 4, you have patients there, because there you need to refine the cylinder and you have a Focimeter kept. So usually people advise to do the subjective refinement of the cylinder first, because that takes time, and then the Focimeter. This Focimeter you should by the time you appear for the exam, you should be able to do it in 3 minutes time. And room number 5, again, you have a patient where you have to do refinement of the sphere and binocular balance. I hope everyone who's listening have some idea, because these are all common refractive procedures. This talk, I'm not going to give you a skill how to do retinoscopy or how to do this objective refraction, but what the examiner is expecting out of you. So what all skills you need to polish before you go for the exam. So the room one, it's going to be looking like this, where you have a mannequin, just the head, and it is mounted on a chair, and of which the height you can adjust. So this becomes important because you have to adjust the height according to your height, and make sure that the light rooms can be dimmed. All that can be done. It's best if you, and these retinoscopes, which is simulator model eyes, are mounted on within the mannequin's eyes. So that's how they do it. Do the stations for the simulated retinoscopies. Now, what I would recommend for you to have when you go for the exams, all these are provided in the examination stations. So if you don't have your own, there is always backup. But I would recommend you to take your own, because if you're going for the exam, you should have one either begged or borrowed, or from your friend, your optometrist, or someone. You should have a retinoscope for at least 2 months before going for these exams. So you should have your own or somebody's borrowed ret, the cross cylinders. All these are not essentials, but would help: a pencil and eraser and a Ziploc bag. And another one I would strongly recommend is an A4 size paper in which you have printed a protractor. Even during when you're practicing, it's better if you can keep that paper on the side, so that you can immediately assess the axis. Just swing over to the side over the axis and just check with it blown out. So the protractor image is blown out on an A4 size paper. Before, I remember for the exams that I appeared, it was there on the examination station itself. So it was just easy. We could just swing over the side of the wall and see what it is, even though we all had it folded in our own bags. But it's easy when it's there on the wall. It takes just a second to check and refine your axis. But so make it a practice to have all these things with you day in and day out when you're practicing for these exams. The other thing that is useful is a lens rack. If you don't have that also, it's fine. Wherever you're working, you'll have your own trial sets. You can use that. For exams, you'll be given trial sets. Don't look at the color of the lenses. The red and black can be always interchanged. So don't go by the color. Always know that on the right-hand side, it is the plus lenses. That's always the same. So now those are how the rooms are going to be like. And after you get out of each room, like the room one, first 2 simulations, there won't be I'll explain later as to what they expect out of you when I say technique, because a major portion of the mark is technique for room 4 and 5. Now, how to prepare. Now, coming to, like, if you're a fresher and you've never done any retinoscopy in your life, then I would recommend go through this website of AAO, the Retinoscopy Simulator, to get the hang of it, to see what kind of reflex they're talking about. Do it so well that by just looking at the reflex, you can say the power, or you get close to the power. You'll understand what I'm trying to say if you've done enough and more read. By just looking at the reflex, you can guess the prescription, either plus or minus of this much. What a -6 reflex looks like, what a +6 reflex looks like, or what a very close +1 prescription looks like. It's always the smaller prescriptions that will struggle with time. The bigger ones are easier to do. So we usually get them easier. But the smaller ones, the small myopes, what's the small myopic astigmatums, since what I usually find are more trickier. Now, this is something, this is a Heinz model eye, which is available for purchase. It doesn't have to be Heinz, what is kept with that. There are cheaper Chinese models available. You might not have so much of variety in which you can change, but the Heinz model helps to change the pupil size, the refractive error, the axis, everything can be changed. So this is what I would recommend you to use, because you do have simulated RET when you're starting off, even before patients. If patients are easier for you to do than patients, but anyway, you have to be familiar with how to do on a simulated RET also. So I would recommend, if you're in an institute, get one for the institute, or pool in and 10 of you buy together one and practice, or it can be handed down. Which either way, because you need to get to a point where your friend should be able to put in a lens, and within 3 minutes, you should be able to get the RET, whatever it is. Why I'm saying 3 minutes is you have total of 10 minutes in a station, within which you have to do the RET for both eyes, both the right eye and the left eye, and enter it. So the entering part, there's no marks if you don't enter anything in the iPad. So even if you don't get anything, make sure you enter something in the iPad it'll be kept. All this is given the iPad, the website to practice on the iPad. So even when you're practicing your RET, make it a habit to enter the detail, not just in a piece of paper. Of course, everyone can do the first cross in the paper, but you practice entering the data in the iPad, the website mode that they have given. I'll explain that also later, how to do it, and how to use a Focimeter. Your optometrist or your orthoptist are the best friends for these. Dig up different kind of Focimeters, because you can't predict which kind will come for your exam. So there are 2 or 3 different models which are commonly kept. One is this one, and the other one is the screen visible? Is the Focimeter visible? Anuj?
Hello, yeah. It's visible.
It's visible.
Yes, yes.
I'm not able to move this away. Yeah. So there are different modes, and how to practice this is there in iDocs, the steps and how to do it. So you should be able to challenge yourself to getting different types of glasses, old pair of glasses, stick on some Fresnel prisms on it and try and do it. Use bifocal pairs to find out, because you'll be asked to find out the distance prescription, the ad, as well as the prism. All 3 are required for the Focimeter station. Well, resources, yes, there are a lot of YouTube videos, there are a lot of online resources, but the best resource will be your Optom. So go spend a few days with them, I would say, not just a single day. A single day would help you to get on track, find out, hone your skills, identify where you're going wrong, then practice, and then come back, because they will be able to help you, especially with the busy practice of an Optom, either in your medical retina clinics where all pupils are dilated. All those help. But mind you, most of them end to be pseudophakic. So better if you can do even in phakic eyes, cataractous eyes. Challenge yourself to be able to do in different kinds of media densities also. These are books that are available. There are different online courses available now because of how this exam has gone global. So you will find that's also another option if you're thinking a bit more long term and if you had no exposure to refraction before. All of you have studying for your post-graduation would have some exposure to refraction, would know how to do retinoscopy. But the difference with this exam is you're doing it under timed pressure. And you're doing it on a simulated eye. And the fact that you have to actually enter it in a different format. So the people who didn't clear first time, it's not because they didn't know how to do retinoscopy or know how to do refraction. They all struggled with the time. They all struggled, even though they have found it, they've not been entering it into the iPad properly, or they entered it in the wrong way. So I'll come to all those later. Now, what to expect on the day? It's like any other your MS or FRCS exams, where you have stations, where you have OSCE stations, where you have, here you'll have 5 different rooms. Now this is a just a format of how the iPad format looks for the ret. Let me just show you. This is a website. If I just show you a demo of how to. This can be accessed anywhere. So if you put this link on, what comes is the Royal College website like this. But then on the top of it, why is it not visible? So yeah, you have login and you have refraction. So if you go to the refraction side of things, you'll come to this page where you can click. So you can do this on your iPad, you can do this on your laptop, when you do, even when you're practicing your ret. So you start practice, you can play with this, make sure you're totally comfortable with this. Even when you're practicing, use this, not just pen and paper to document your findings. So if I go to station 1, this is just to give you an overview of how to enter the results. And you have a timer on that iPad. So it will shut down at the end of 10 minutes and you won't be able to enter anything. So when you're doing retinoscopy in a simulated setting, I would say do one eye, enter. Then do the other, then enter. At the end of 3 minutes, 30 seconds, or barely at 4 minutes, if you have not finished retinoscopy, whatever reading you have got, just enter. Because that also matters. Perfection is not what we are aiming for here. We'll come to the marking scheme later. Why I'll explain as to why I'm saying that perfection is not what we're trying out here. So if I say start, and if I've selected the first ret, this is what I'm coming to. So the first question number 1, that means your gross retinoscopy, your cross, that is what has 12 marks. So if I click here, this is a cross that comes up. So everyone is comfortable drawing it with your hand. But if you want to change the axis and show 120, just move it across using the rotate +5 or rotate -5, and then enter your power. And entering the power also, just be careful whether you're clicking minus or plus, and the whole number and whatever it is, and then close. So this, yes, it is easy, but when you're doing under exam conditions, don't click on the wrong button, because even if you've done everything perfectly and what's entered in the iPad is wrong, then you don't get any marks. And ensure that you enter for the right eye, and don't enter the final prescription here. And then you go back and then enter your working distance in centimeters, how much ever you are taking. Mind you, this will give you 1 mark each. If you don't enter how much you are going to minus, you're losing that 1 mark. So even if, sorry. So I know people who have not got their refraction have just entered that, their working distance for every single ret they have done and got that 1 mark. It just adds up. So don't miss out on that opportunity to get that free 1 mark by just writing your working distance there. And that is the same for everything. So have a play around, see what works for you in that iPad mode. And that is the same for everything, not just the simulated ret, but for every single station. So we go to subjective refractory, get into the habit of doing this, entering the mark here, scrolling down and down. You have to be perfectly comfortable doing that. And see, the timer over here will completely shut down. They'll give I think, a warning signal at 5 minutes and at 9 minutes, something like that. And exactly at 10 minutes, it just goes off. So better record something, even if you have not completed it, that would be my suggestion. Coming on to my back to how you're going to be assessed. So as you saw in that iPad practice, the every question is 15 markers, so a total of 150 marks, of which each ret is 15 marks, of which 12 marks is for the first, your cross, 1 mark for your working distance, and 2 marks for the corrected spherical correction. And it doesn't matter if you're not going exactly the right numbers. How they're going to mark is how much is your refraction. Supposing the patient wore your refraction in place of the correct refraction, how much is going to blur that vision, blur his vision. So it's objectively assessed using a computer algorithm. Now, and be very, very comfortable using the logMAR charts or the ETDRS charts. Get rid of your Snellen's chart. Don't use your Snellen's chart. Make your patients read the ETDRS chart or the logMAR chart, because we're so used to the Snellen's, and Snellen's is not what's required for entering data here. So you should get used to the letters, to the spacing of the lines, everything of the ETDRS chart rather than the Snellen's, which is commonly used when we do our clinics. And you should be very familiar with the logMAR notations. So when you're asked to enter vision, it's not 6.6 final vision. It's not 6.6 what has to be entered. It is 0.00 if the visual acuity of the patient is 6/6. And that is 1 mark. So simply entering 0.0, you will get 1 mark, even if you've not done the refraction. But obviously it's not enough for you to pass, but that just stresses how well you should be knowing your logMAR. You should be able to, 6/60 is 1 and 6/12 is 0.3 should be at your fingertips. So you should be able to say it in seconds. Now coming on to the technique, how you're assessed is, once you know how to do subjective refraction, you'll understand why all these points are important. So for how they put the trial frame, whether you've tested the visual acuity in each eye, whether you've fogged your eye, whether you've offered a plus lens first, where you start with line, where you mention the right words. So they ask, is it rounder and clearer fluorescence, or is it just darker? So both have different meanings. So you have to use the correct language for each lens, whether it's plus lens or minus lens. All that matter because we are trying to refine the sphere there. not just give the prescription. Then, so all these things are what the examiner is looking for when he's assessing you for the technique for the subjective refraction, and that carries around 9 marks. Having said that, just by doing your RET, if you're perfect with your RETs, there's still a very fairly good chance that you can pass the exam. That's also there. So don't get stressed out if you lose a station, or if you lose, because those are patient dependent, and if something goes wrong, you can always fall back on your RET. If you're strong on your RET, you will pass the exam. But this will just give you better points or act as a buffer. And with the binocular balance station, the same things, again, techniques is being checked. For finally, whether you're looking with visual acuity is blurred up to the 3 lines or worse. So that's the end point. So the patient can read till 6.6. You blur them till how much? 6.9, 6.12, or the line above that. And then you start. And ensure that you are fogging the eye, not occluding the eye. So small things, but all these matter, and that's what they're looking for. And when you get once you have written the exam, you'll get a feedback, and they'll exactly assess and let you know as to what technique mistakes you have done, because they'll be assessing, there'll be comments on where you've gone wrong with the technique, if that's where you've lost your marks. Coming to the Focimeter station, there again, it's a 15 marker, where you have to enter the prescription for both the right and the left lens, glass prescription. If you enter only one, then you don't get any marks. So just make sure, if you have managed to get one eye and you don't have time for the next eye, just enter something for the other eye, because whatever you've entered becomes invalid. And practice more prisms and more rads, not only just the power, but the direction also. Yeah, as I've repeatedly again and again said throughout, these common mistakes. So practice more, you will be able to manage time much, much better. And once you do a lot, you'll understand where you're making the error. Small additional mistakes, +2, -2, all that makes huge difference in your values. So finally, practice. There's no other way to perfect that. It's an art. It's a skill, and you'll enjoy it. Once you have the skill, it's there for life. So I know a lot of people will be like, why do I need to do refraction? That's the job of the optom. Yes, it is, but it doesn't hurt you to know that. And that's another website which will help you to practice on the Focimeter. That's it. I can stop sharing now.
Yeah, so I think that was pretty comprehensive. So I'll keep the session open if anyone wants to have any question directly with Dr. Tushara. Please can use the mic and go ahead. Yeah, Mansi, you can use the mic.
I wanted to know which is the exam which helps us to settle down in Dubai. Is it FRCS, FRCOpth?
You don't need any of those exams. You just have to have DHA license, as far as I know.
No, like for better prospects.
That depends upon your circumstances. That's
okay.
None of these matters, actually.
Okay. Yeah,
None
that
of
was
these
my
matters. But at the end of the day, if you've gone through the DHA site, there will be different categories of, my knowledge is very limited on that, or it's very outdated because I have gone through it maybe 8 years back. So there used to be specialist under supervision. I think they've taken out the specialist under supervision category and the consultant category. So the consultant category is not open to any Indian candidate unless they, so most of the Indian doctors end up as a specialist, provided they unless you have, and that too, you need around 5 years of experience. Please correct me if I'm wrong. You do have to go through the current requirements, but none of these fellowship examinations or anything are required. But they will help you get Dubai. If you're planning to settle in Dubai, as you know, people live in bubbles. Hospitals are of different cadre and grade. You're all ophthalmologists, but your pay differs very much based on what cadre you are, which hospital you're working. So if that's what you're asking, then you always aim high.
Right.
Consultant positions are usually reserved for people who have trained from either UK, US, Australia, any of those who go through the training program in these, not even for doctors who are in the specialist register in these countries, are given direct consultant degrees. For example, we know of people who have done the Caesar or the portfolio and under in the specialist register in the UK, but even then, they may not be given a consultant position under the DHA criteria, unless they have worked for 5 years as a consultant in the UK, things like that. So it is a very biased, hierarchical system over there. Even people who have done training in UK and gone there are lots of hoops to jump if you want to practice as a consultant. So the pay differs between a specialist and a consultant. Both are very different and different with a passport also.
Okay. Right. Thank you, ma'am.
Hello. This is Nejla.
Yes, Regila.
Nejla. I'm also from RI Trivandrum.
Hello.
I wanted to ask, there is a question in the Focimeter. Centralize the right spectacles and find the prism in the left. I didn't understand how we can do that. Like, last question, to find the prism in the PG, they are asking to centralize the right glass first, then find prisms in the left eye.
To tell the truth, I don't know the answer for that, but usually I know prisms are given half-half in both eyes. That's how it's routinely done here in the UK. So if you have a 10 diopter prism, it is split as 5 in the right eye and 5 in the left eye. But that sounds a bit tricky as to why you have to use one lens and you're asked the prism of the other lens. Sorry, I don't know the answer. If I come to know, I'll let Anuj know.
Okay, madam. One more question I have. When we do the accommodating, like the non-cyclopedic refraction, which is the best method to do? Which the fogging or occlusion? And if we are doing fogging, how much we should do? +1 or +2?
You're talking about retinoscopy or subjective
refraction? In retinoscopy, for the non-cyclopedic eye, the patient, because the patient may not see the far, and he may accommodate, and that affect our value. No, that is why I am asking.
Under exam situations, you just have to occlude the other eye. At least that's what I have done. That also, if there's anything different, I'd let you know. Because there you're not just the value, looking at the technique, how you're doing it. You barely get 3 minutes to do that. And
No, madam, the retinoscopy, the subjective I am talking about the non-cyclopegic retinoscopy.
so that's with a patient, right?
That is the patient. Yes.
You are occluding the other eye and doing for one eye and then occluding the other eye, right?
Okay. Occlusion, I think it might cause some accommodation. That is why I don't know. That is why I'm asking.
Okay, practically, I have only occluded it. I'll come back to you with these two.
Okay, madam.
If there's any difference, because I have occluded for my exam.
Okay, madam.
Sorry, I couldn't be of help in that. Those two questions.
Hello, madam. Thank you for your wonderful presentation. Can I ask you a question?
Yeah, sure.
Or is there a station of the hand neutralization in the
No, there's no
refraction
station. No, there's no
station.
There's no station for neutralization.
Okay. And another question is that in binocular balance test, can we use any methods we prefer, like the +1 blood test or the Humphreys method, or the any method we prefer? Can we do?
My colleagues have appeared for the exam recently. They all talked about the +1 blood test. I'm not sure about the other methods, but that's what they have used. So there are courses running for these here in the UK. There they were told about the +1 blood test.
Okay.
About the other methods, whether you can use or not, I'm not quite sure.
Yes, madam. And for the retinoscopy, can we use the retinoscopy rack, or the if we don't get the exact number, is it okay for the exam? Like because the exam is time bound, and so we have to finish in 3 minutes. So it's very difficult to gather exact power in 3 minutes. So
so you won't be penalized much. You won't be penalized much. Supposing if I give a imaginary prescription of 2.25 with a -1 cylinder at 180 degrees, if that was the correct answer, and if I have written as -2 with a -0.5 cylinder, out of the 15 marks, I would get something like 11 or 12, which is not bad. Yes. Which is not bad considering if you're adding everything up. So that's why I said, don't sit to perfect your first, because everyone in the first station tries to be perfect and write down the correct one. They know they're somewhere really close and they spend a lot of time getting that correct value, and then realize that they're not been able to enter the whole thing. So that's a common mistake done by a lot of candidates. So if you find, it all depends upon your time management. That's why I'm stressing on the 3 minutes. You have 5 minutes to do a ret with the one eye, 5 minutes to do and to enter. So I'm just giving you practice with a 3 minute in your head, so that even if it overruns, if it's a difficult ret, or sometimes we fumble with the lenses because everything is new. You would have practiced in your setting, in your clinic, using your own trial set, which has a definite color, red and black. So try and use as many trial sets in different settings and in different heights, especially the shorter candidates, they'll find it a bit more difficult, or even the taller candidates also find it difficult. So on the mannequin. So that's why I'm saying that don't be too much bothered about the perfection of the result. If it's perfect, it's excellent. You'll end up getting the highest mark in the crowd, but you don't have to be perfect to pass that exam.
Yes, madam. So regarding that Focimeter, if we are not familiar with the ones we tried before, so if we are not familiar with the Focimeter,
There are
how can we?
three standard
Yeah.
ones. The pictures of which I showed in that, those 2 or 3 are the ones that are commonly kept. I can look and find the make or the model, but those are the ones that are commonly kept. So if it's a different one from what you have at clinic, find out where you can get it. Nowadays, nobody has it. That's the problem. Everyone has an auto ref, in which the lens comes. It's much, much easier. But this is what is there for the exam. So you need to practice. And after that, after you finish these exams, you forget also how to do it.
Yes, but I heard that in some center, the Focimeters are given before the examination. So how about the Focimeter? Are they given before before our examination? Or is it true?
I don't know regarding that. We didn't have that kind of an experience in the UK. And so I don't know about the other international centers.
Okay, thank you very much for your answer.
And it's a team. I know for a fact that the team always doesn't travel from UK. The team may travel from India with the instruments, but the standards are always set to the same Royal College exam standards. So the examiners may be traveling for Singapore or a Kuala Lumpur exam. Examiners may be, FRCOpth examiners may be traveling from India because it's shorter route now. So they're preferring local examiners. So I don't know about instruments, but it's usually from the base hospitals where they are done. But they do have to stick to the same UK standards. Hope that was helpful. Or...
Definitely, that's.
Then for the final part and FRCS Glasgow, which is better, whether we are sitting in the New Delhi session or in the UK, which is easy to pass?
For the final FRCOpth you're talking about, right? Not
Why?
what I'm talking about is not about Glasgow, it's about FRCOpth.
Okay.
Because FRCOpth is a standalone one. It doesn't let you do anything of FRCS Glasgow, or nothing in FRCS Glasgow will help you write FRCOpth exams.
Madam, my question is like, when we are writing exam when we are sitting exam in India, all of our colleagues are Indians, and when we are writing, when we are appearing exams in UK, the rest of the candidates are familiar with the UK standards. So, in my question is, which will be easier to pass, because the UK exam is much more cheaper than India. Even though if we calculate the travel also, it's cheaper in UK. In Indian exam, it's very costly.
That's a tricky question to answer. You're talking about the last oral examinations. I'll give you few points for it and against it. Like if you're writing your exams, because I can say only based on my experience and my experience regarding my exams.
Okay.
And I'm only a recent examiner, so I've not started examining in international sites. So I can base whatever answer I'm giving is based on my experience, so it might be biased. So when you're considering Indian exams, for all these oral parts, you have patient and you have simulator.
Okay.
So patients and conditions, you'll always have things which you're familiar with. You're
Okay.
familiar with the kind of clinical scenarios that are there in India. You're familiar with how the iris or the pupil or the lens looks, fundus that looks in India. In UK exams, there are some conditions which you hardly ever see in India. There are
Okay.
some things, but having said that, there is only for neuro-ophthalmology, you have 3 patients. Rest all are half simulator, half videos, and half patient. And so not, the standard of the exam as such is in such a way that they don't want someone to know in depth or in the standard is just so much so that how much a consultant who needs to practice in UK needs to know.
Okay.
So it's totally different from the Indian perspective, where the more depth you go, the more exotic things you say are considered good. But in the UK style of exams, there are some basic, there'll always be marking schemes. So if you say this, you'll get it. You'll get the marks. But if you say something that raises a red flag, then you fail.
Okay.
So you're all talking about oral exams. That is better for another session because that is another huge topic in itself.
Okay, madam.
All the different stations itself, I can take 1 or 2 hours for each session, like neuro-ophthalmology, communication stations, which we have done, our colleagues have taken for each other, because there is a huge pool of doctors who have come from India who are working here. They might have all cleared their FRCS or any other oil exams, but still not able to practice as consultants. So we all end up taking our FRCOpth again, right from scratch. So we've all gone through that rut in which each one might be good in one specialty, because most of it end up being specialists coming here. So we are not good in the other specialty. So we end up teaching each other. What I'm trying to say is that the whole FRCophth oral examination, it requires a bit more in-depth knowledge and discussion, which is limited in this refraction section.
Okay, madam.
And coming back to whether India or the UK exam is better, and still it varies from person to person. If you've never worked in a UK environment, I wouldn't say it is not possible, but still a bit more trickier. So you have to, it may work or it may not work. I have done my, just coming from my experience, I've done my once in Glasgow and once in Hyderabad. So the Glasgow was my first attempt and Hyderabad was my second attempt. So obviously I didn't clear my Glasgow attempt. Hyderabad was a much more easier one for me. It could be because of 100 reasons that I was much more prepared. I had another 6 months. I had done more of, I had failed only in one station at Glasgow, and that was like a total fail. So the examiner didn't want to pass me at all in that station, even though there were 3 patients. And even though I know I had seen 2 patients, the no marks given. So it was a total fail for that station. So I had more time. I spent more next 6 months concentrating on medical and VR. So obviously for my Hyderabad exam, I was much more prepared. So that's why I'm saying red flags. Red flags are important. So whatever you do, if a red flag gets alerted, you're a fail in that station. That means you have committed something so gross or patient negligent that you are not fit to pass. That's how they categorize it.
Okay, madam.
We'll
That
come
was
to flags when we discuss regarding the oral examination.
madam. Thank you. Thank you for the answer, madam.
You're welcome.
Basically, it's sort of what we say negligence of omission or commission. If you miss something,
Miss
and if
something,
you
it's
do
too
something
grave
which
of
should.
sin. Yeah, it's too grave of sin to be missed.
Anyone else want to ask Dr. Tushara anything before we let her off? I think these points are very important. First, the small marks which we can gain, even if we go wrong. These are very important. And even for the fact that you don't need to be 100% sure in your retinoscopy, because that is where most of us feel that we should postpone the exams and still master it. So even if you can do a bit of it, is whether you're confident, is I think you should go ahead. That
You should be confident of doing it. There's no halfway around it. You should be totally confident and confident enough to do it in 3 minutes, not 10 minutes.
yeah, speed is
The
very
only leeway I'm giving is it doesn't have to be perfect.
Yeah.
That comes with practice, and your optometrist is your best friend.
Yeah, and you need to buy an iPad. So that is
It doesn't have to be an iPad. You can keep your laptop or some
okay.
device in front of you and start doing it. It's just that clicking of the buttons. The more you do it,
Right.
it comes naturally. It comes faster to you. You're just familiar with it. And the ETDRS chart. Before, they used to give the Snellen's chart when we were doing the exams. So each exam it changes. So whichever exam you're appearing, please look at the latest guidelines, because each exam they keep changing something minor. And then because we didn't have, I remember I did it somewhere during COVID, and there was no refinement of cylinder and sphere. Now that has come back. Focimeter didn't have a prism in my, and yeah, that's the other thing. They say they will keep a prism. They may or may not be a prism.
Okay.
So it's not a definite that they have to keep a prism. So if you don't panic if you don't get the prism. If it's not there, it's not there. Just enter 0. Just move on to the next station. Yeah, and don't panic. Whatever station you have one, even if you've gone 0, just go to the next one with a. It's easy to say all this when you're standing there between stations with an adrenaline rush. Just go with a calm mind. The next one will be better. Just think like that and go, but still you can make up.
And these courses which you were talking about in UK, are they like online or is it like
Try
for
them. I've not
okay.
done them personally, but I know there are lots coming up because of the high stakes involved.
Right. I think they'll come up in India as well now.
Yeah, they'll
The
soon come up in India.
centers.
Yeah.
So I think that was this a good head start, and definitely the next session is on for the oral exam. So whenever Dr. Tushara has time. And,
Yeah, that actually has to be something like a 6-part, 7-part series and all, if it has to be done some justice.
so thank you, Dr. Tushara, and it was really this detailed this and these smaller points which we tend to miss, and that website which we tend to ignore, and we just look for your saying, but everything is on the website, and even with now AI, you can ask a lot of questions and you can get a bit of information. Yeah, even just on your WhatsApp, if you just use the Meta AI and ask what is the FRCOpth refraction exam, maybe you will get some insight, and definitely this session by Tushara will add on to it. So the bottom line is you have to practice, and but even if you don't make perfect, it's okay, but be there. Unless you practice, you will not be able to clear it.
Yeah, without practice, you can't.
Yeah, especially if you're from India.
At least go for a mock exam. That's if there
Yeah.
are 4 or 5 candidates together in a
Okay.
city, I would recommend just do a mock. Do a mock for your own peers.
Right.
Because we've all done that. Just create a mock scenario, give an iPad and do it for an hour. That's all it takes, 1 hour. Then you'll know. what you lack.
So maybe when Dr. Tushara is next time in India, we'll have a live session.
Happy. I'm happy to entertain that.
Okay, so I think it's already past 10 here, and
Oh,
Dr.
sorry.
Tushara also we'll let her off. And thank you for the time, and we'll catch up again.
Thank you, Anuj. Thank you for
Thank
the
you.
opportunity.